The doors are open, but so far the only people allowed in South Australia's dedicated COVID facility are tradespeople. They're getting the hotel ready to accept its first arrivals next week, any travellers who test positive.
We want to make sure that our hotel quarantine situation is as safe as possible. We learnt a lot from the Parafield cluster.
Those lessons include segregating positive cases and protecting against airborne transmission, which has been behind quarantine leaks here and interstate.
We now know that ventilation is a major factor and aerosol spread is a major factor, and we have to get the ventilation right.
Thousands have been spent modifying the 72-bed hotel to make it as secure as possible.
I know that ventilation was part of it, also some of the floor surfaces as well as the CCTV in the corridors. So these were some of the things, some of the modifications that were made.
And as another return traveller tested positive in hotel quarantine, daily saliva testing is also being introduced for workers at all medi-hotels. To minimise the potential of any community transmission, only dedicated SA Health and police staff will be working here. As an extra precaution, they won't be allowed to work at other medi-hotels or any high-risk places like hospitals or aged care.
If any of them get infected, they're not going to take it out into the community to another job. There'll be a far greater ability to keep it controlled in that way.
There'll be more control over people isolating at home too. The government's contracted a WA company to implement a new app to track people using facial recognition and phone location data. Until it's rolled out, police will continue to carry out random checks. Richard Davies, ABC News, Adelaide.